uh, presentation. Regression of Clinton after theater of lung cancer. The bronchopulmonary carcinoma. The bronchopulmonary carcinoma is the most diagnostic tumor in the world, and in some tiny deaths causing the greatest number of deaths caused by cancer. We are facing with a design of great social impact, which also represents a younger chance for professional treatment. Surgery represents the most appropriate treating the small cell lung cancer in Harlem. Stacks despite the fact excess growth on patients can the oxygen survey raise 5 years higher than 70, more than 15. Several years of patients will have under resection these fronts. General clinical features. The 19.5% of the patients were males with an average age of 61 years, standard deviation 9 years. The 15.6% of the patients were activity smoker from an average of 17 age. Past years, the 39 smoking in 17 past years, and only 6 were non-smokers. Diagnosis with shortness. The 14.3% of the patients were diagnosed with shortness, obstructive pulmonary disease, and premium source of non-malignancy of takes the mortally relaxed to the fumes 59 and ungodly 22, which shows the smoking the important etiologic factors. Symptoms with regards to the presenting symptoms, the most frequent were coughs, hemoptysis, and chest pains. At 13.3% of the patients under symptoms due to the signs and diagnostics be appropriate radiologic studies or relax to other pathology. Circulating cancers of the
old man that has had in history a very difficult story. He had 15 years ago a cancer of prostate that was treated by cryosurgery, and for good luck he has been lung. This cancer required a total removal of the lung and of the pericardium and residual lung of 2 centimeters. No chances for treating him with any kind of therapies. No surgery, no chemotherapy, no radiotherapy. For this reason he came back to his cryosurgeon to support any general anesthesia. And we are going to do a cryosurgery of this residual tumor as we are in this moment. A needle and another needle are introduced in order to destroy totally the cancer cells inside the lung. After the therapy, The patient will receive some antibiotics, and we're going to send the patient home very soon. Cryosurgery may be a good treatment for cases so difficult as this patient is. Today is a very lucky day. I just received a phone call from the gentleman. A travel of 3 hours airplane, 3 hours car, in any other way.
Anatomic pathology. The most common histology is wart and door carcinoma 26 and squamous cell carcinoma 42. Up 11 of large cells undetected carcinoma as the 6 constitutes of percenters.
On Thanksgiving, I'd been having chest pains, and I was afraid at one point I was even having a heart attack, so I went to have it checked out, and my heart was okay. But they found something more serious.
In November of 2012, I had gone to the doctor to find out why I kept gaining weight. I assumed I had, please don't let it be lung cancer, because, you know, that.
And I did some more chemotherapy, but during that time, the tumors began to grow some more.
So I began chemo.
We talked about the options and decided that immunotherapy was a good possibility, and decided that's exactly what we would do.
I could start in a clinical trial for immunotherapy.
Help the patient's own body fight the cancer cells. The immune system is constantly surveying our body to see what doesn't belong. In particular, the immune system uses T cells to find and destroy cancer cells and viruses. The genes of the cancer cells are unstable and constantly changing protein, which can silence T cells that have been activated against the cancer. The immunotherapy drugs that we have for lung cancer are given through the vein, usually through an IV. What they are doing is blocking the interaction, the brakes on the immune system, and let the immune system treatment that I've seen in my career.
Immediately upon beginning the immunotherapy, my tumors stopped growing and have remained stable for 3 years and counting.
It's something that I think is worth talking to your doctor about.
Conclusions. The most important protective factors for the locals, the worst pleural infiltration, Olympus Knox involvement, the graves of histology differentiation, the graves of pleural effusion is a well-known prognostic factor, and in the series has been the most important determinant to predict the local relapse. Also, as other authors, we found an correlation between the factor if on the other hand means its prognosis both in the multivariate studies. Thank you.